Are you finding that a lot of us in South Africa are ignorant about HIV and AIDS?
I don't think that's the challenge. I think that we have, people are knowledgeable about HIV. I think we're in some ways the victims of our own success. We have turned HIV into a chronic illness, which is manageable for most people and sort of can be controlled effectively with a pill a day. And what that means is that I think sort of in the early epidemic we saw people dying. It was a much more visible disease. We could see the consequences. And now the consequences are much more invisible. But they're nevertheless pretty significant at an individual level. If you think about a young woman who's 16 years old who's diagnosed with HIV, she has 60 years of treatment ahead of her. And sort of for women particularly, there are the consequences not just for themselves, but also if they decide to bear children, ensuring that those children are not infected. And even if they aren't prevented from becoming infected, you know, they nevertheless may suffer consequences from being exposed to infection during in utero. So that's at an individual level. And then I think at a country level, where it's an enormous cost to the health system to keep people on antiretroviral therapy, and we really have to invest significantly in prevention, I think, in order to turn the tap off.
So we know that the focus is on women and girls between the ages of 15 and 24. What are some of the structural drivers of HIV?
So that's an excellent question, and poverty, lack of access to education, gender-based violence, limited livelihood choices. Those are really the things that are shaping young women's risk, and those are not the things that are within their individual control. Those are things that we as a society need to grapple with in order to kind of reduce young women's risk.
So that's something that you said very interesting. Gender-based violence. Are you saying that gender-based violence can enhance the risk of HIV?
Yes.
How so?
Well, most people focus on the idea that sexual assault could increase a person's risk for HIV, but what we have seen is that all types of intimate partner violence can actually lead to an increased risk for HIV. So much so that we would say that about nearly 1 in 5 or a quarter of new infections in women could be attributable to gender-based violence. And there are a number of pathways by which that could happen, but I think one of the sort of key pathways that we've understood is often partners who have HIV are unlikely to be on antiretroviral therapy, and they may have multiple partners, and they may be an important risk factor. And this is why prevention is really sort of something that needs to take place both amongst men and women.
And your institute is testing multi-purpose prevention technologies, isn't it? Tell us about that.
Yeah, so the idea of multipurpose technologies is the idea that we could prevent HIV infection, but with the same product we could also prevent pregnancy or in some instances sexually transmitted infections. So as an organization we've been involved in evaluations of first oral PrEP and then a vaginal ring, which could be combined with a contraceptive. And we're also involved in evaluating a long-acting injectable PrEP, which would be an injection given every 8 weeks. And the idea is that if those products are found to be effective, we could add in contraceptives, which would mean women could get 2 products with one. So the aim, I guess, when we're talking about drugs is to make it cheaper and with less side effects. What are the clinical trials telling us? What has it shown? In terms of PrEP?
In terms of the antiretroviral drugs on the market?
Well, I think the big story at the moment is the introduction of TLD. And the idea is that by adding dolutegravir, we have a drug which is a very potent antiretroviral. It has a high barrier to resistance and a low side effect profile. And that's very desirable given the size of our HIV program. And with that comes reduced costs, obviously, which is also highly desirable.
How revolutionary is TLD?
Well, I think it's very important for us, for that reason that we have a drug which makes it easier to take antiretrovirals. It means that people can be more adherent. It means that we can achieve better rates of viral suppression, and ultimately that means we can reduce transmission. And so it's an important prevention strategy as well.
If you had to review the country's efforts over the last 25 years, do we have a much better understanding now of the challenges that lie ahead 25 years compared to 25 years ago?
Well, I think we've made an enormous progress, and the fact that we're close to achieving the 1990 goals is a real tribute to the commitment, I think, of healthcare workers and people across the country to address the HIV epidemic. We still have a ways to go in terms of prevention. You know, the fact that so many young women continue to be infected means that we've got work to do. But we understand a lot more about what we're grappling with. And I think there's a lot of promise in terms of the new prevention products that are currently being investigated. In fact, sort of the pipeline is quite full of new products. You know, we have the vaccine trials, we have trials of what we call broadly neutralizing antibodies, and we have trials of new PrEP antiretrovirals that are long-acting, and so that is very encouraging.
Would you say our science compared to the rest of the world is top-notch?
Yes, I think there was a report, you may have heard of it, it was released yesterday, showing that some South African universities are in the top 10 universities globally that are publishing on HIV/AIDS research.
Yeah. So, if you had to maybe list two things that we can celebrate on World AIDS Day in South Africa, what would it be?
Well, I think the fact that we have managed to reverse the mortality rates, the fact that we've seen a return to life expectancy prior to the HIV/AIDS epidemic, that is probably the biggest triumph, and that we have so many people on antiretroviral therapy. And also I think how we've used our science really to advance the kind of treatment of HIV.
Talk to us about, you know, we often talk about the issue of stigma, which is really a big hurdle to jump over here. But, you know, when somebody contracts HIV, you know, break it down first from your research. What do they go through both physically and socially?
I think it's very complex, and I think every person probably has their own experience. My experience has been working with adolescents, particularly kind of young women, and I think that most people who have acquired HIV, you know, kind of will suffer a kind of period of coming to terms with that. I think for young people, they may have difficulties disclosing to their peers or to their family. You know, kind of it's not without its challenges, but we've made significant gains in terms of kind of reducing stigma and, you know, kind of ending discrimination. I do think, though, that for adolescents in particular, there are sort of important judgments around their sexual behavior and how they acquired HIV infection, and those are things we still have to tackle.
Look, in order to turn things around, you need political will, you need social will, but you also need money. We know that in South Africa, we have one of the largest domestically funded programs. I think around 80% is funded by government. What about the other 20%? Where's it coming in? Pepper?
Yes, we've had significant international support, and that has been incredibly important, I think, to the success of our efforts. We're one of the few countries in the region that has been able to kind of foot our drugs bill. But, you know, kind of delivering a program is not just about giving people pills, it's the entire infrastructure to do that. And I think that without international funding, we would not have achieved the success that we had. But I think the other important thing is that HIV as an infectious disease doesn't know boundaries. And those investments are incredibly important for the security of the region. You know, kind of there are people who will cross borders, and that is why it's important that the program is strong in South Africa, but also that it's strong in the region. And that's partly why international investment has been so important. What
about, you know, how secure is this funding? Because my point is there globally HIV fatigue?
I think it's a concern that we have, you know, kind of, I think that in an effort to kind of inspire people to believe that HIV could be controlled, we may have called the end of the HIV epidemic too soon. And with that comes the risk of kind of people's loss of interest in HIV and the need for funding. And certainly that needs to be sustained beyond the kind of immediate future.
Look, so many interesting elements. I mean, I didn't, to be honest, know that gender-based violence, you know, can enhance the HIV risk. You live, you learn. Professor, thank you very much indeed for coming through. We'll touch base with you a little later on, maybe to pick your brain. the Deputy President will be delivering the main address. So thank you very much indeed for coming through.
Thanks very much for your time.
All right, that was Professor Sinead Delany-Moretlwe. She is from the director, well, she's the Director of Research at the Wits Reproductive Health and HIV Institute.